Hey everyone, I hope you're all well. Well, it's Saturday. I have just survived a children's party ×2, Finley and Coral's birthday parties, and I thought I'd take a few minutes out now to talk to you about the next part of my corrective surgery, and that is all of the things that I need in order to prepare for it, both before and afterwards. So, first things first, I usually take these omega-3, I'm sure lots of people do. I have to stop taking these now for a few days because they thin the blood, so that's not good if you're having surgery. So they're a no-no for a few weeks. I've got these little body wash sponges that have been provided to me from the hospital because on the morning of the surgery I'm not allowed to wash with any body lotions or shower gels that are scented because that can cause infection. So I've got my little sponges. I've got a few things. Arnica, these are the 30C versions. I use these when I've had a C-section. Great for aiding healing. I've also got some 200C potency strength ones winging their way to me, which I'll use for a few days after the operation and then transfer to these. And because I'm having liposuction, which I'll talk a bit more about tomorrow, I've also got the cream that you can rub directly onto the bruises. So Arnica, in my book, I swear by, and it did wonders for me when I'd had my C-section, I believe. I've got this bromelain, which is great for aiding swelling after the event. It's just a natural formula. It also has turmeric in it, which is supposed to be very good. So I'll take that along with gallons of water, which is apparently the best way to stop swelling. And also not to take salt, but I don't have salt at all in any of the things that I cook. I never add salt to anything, so hopefully that will aid me. I've got loads of books because I can't exercise, and I'm going to talk about that a bit more tomorrow as well, but I can exercise my mind. So I've got good old Brené Brown. I love her. Daring Greatly, which I kind of read half of and never finished, so I'm going to finish that one. Playing Big, which was a recommendation from one of the Leanies, so I'm going to read that. And also this, which was sent to me free by one of the Leanies. She's a book publisher. Eat, Sweat, Play by Anna Kessel. So I'm going to give that one a go. So that'll keep my mind occupied. Can't wash my hair for probably about a week, which is going to be a bit of a nightmare. I normally wash it every 3 or 4 days. So I've bought some nice Redken pillow proof blow dry shampoo. Must have for any woman. So I've got that. I've got Trusty Lip Balm. This was bought for me by one of the Leanies at the seminar, Tracy. So thank you. I haven't used it yet, but I will be using it. It's gin and tonic flavour, bizarrely. So that's going to go in my hospital bag to keep me nice and hydrated. I've got some CoQ10 pills, which are all about energy. So I take these now and again. I don't take them as a general rule, but when I do take them, they always give me a really good pick-me-up. So I reckon I'm going to be quite tired after the event. So I've got these to keep me energised. I've got a V-pillow because I'm not going to be able to use my core to sort of sit up or move around. It's going to be quite tough to start with. So I've got myself a V-shaped pillow for in bed and a pillowcase to go over the top of it. So I've got that. And then I've also got this, which has been recommended. It's called Dermatix. And this is for once the scar has healed. I'll start applying this silicone gel to the scar, and it helps to reduce the colour of it and sort of fade it down to a natural sort of pale line. So I'm going to give this a go alongside bio oil and maybe even some coconut oil, but not until it's completely healed. I'm not going to be able to have a shower for quite a few days. I'm not sure how long. Some ladies are saying 10 days, some are saying 7. It depends on your surgeon. So I'm sure Mr. Ahmed will tell me. So I bought tons of wipes so that I'm not smelly. So I've got those. And I've also got plain knickers so that I have got comfy things to wear over the scar underneath the binder. So lots of these because I don't think I'm going to be able to wear my lovely lacy ones. So I think I'm about ready. I've got nighties because I can't wear pyjamas because you don't want anything to kind of go over the scar. So all of these things that you have to think about, it's a minefield really. I also got recommended to buy a litter picker because obviously if I'm sort of sitting in bed or on the sofa, I'm not going to be able to bend down to pick something up if it's next to me. So somebody's recommended a litter picker, so I've got one of those coming my way as well. So I think I'm ready. It's a few more days. I've had people sort of writing to me in the last few days and saying I'm very brave and you know, am I not worried about it? And quite honestly, I feel anxious, more so about the result and my expectations of the outcome, more than the fact that I'm having a general anaesthetic and it's a big operation. My mind doesn't work in the way that I'm having an operation and therefore I might die. I never ever think like that. You know, I'm going into that operation, I'm going to come out of it, it's going to be absolutely fine. And I'm telling myself that the shape and the overall sort of aesthetics of it are going to be wonderful as well, because you have to think positively about these things. It's the only way to do it. So I don't think I'm being brave. I just think I'm taking the next step in my journey, and it's exciting and is going to be quite life-changing, I believe. So on that note, I will leave you to enjoy the rest of your Saturday, and I'm going to speak to you tomorrow about how I'll cope with not training and what I'm going to be eating.